Supervisor Nathan Fletcher says his post-traumatic stress is from combat during his time as a Marine and also intense childhood trauma that's been made worse from alcohol abuse. Post-traumatic stress disorder, or PTSD, can occur with anyone. Federal health officials say about 8 out of every 100 people will experience it at some point in their lives. It's typically triggered by traumatic events.
It could be something like combat. It could be domestic violence. It could be getting into a car accident. It could be childhood trauma, like childhood abuse.
Dr. Sarah Simmons is a psychiatrist at Kaiser San Diego. She says symptoms from PTSD can range from intrusive memories to avoidance or distancing, numbness, or even physical symptoms like feeling on edge or being irritable. She says something key to remember is that PTSD is treatable.
And sometimes it could be really difficult and painful to think about that trauma that's happened. So sometimes it's like, okay, I just don't want to go there. I'm not ready for that kind of treatment. But the important thing to remember is that it works. People can recover. They can feel whole again. They can move on with their lives.
Treatment doesn't always involve revisiting trauma, and it can include therapy, support groups, or medication. Simmons says it's common for those with PTSD to use unhealthy habits like alcohol to get temporary relief from trauma, but she cautions against that.
It's really easy for a person to think, okay, I'm going to have that glass of wine, maybe it will help. But the important thing to remember is that alcohol in itself makes it harder to treat PTSD. It makes it harder to get over those symptoms.
At the VA in San Diego, access to PTSD treatment has expanded for veterans over the last few decades.
A lot of what we hear is, I wish I'd come in sooner.
Abigail Enkow is Deputy Assistant Chief of Staff for Mental Health and a psychologist at the San Diego VA. She says PTSD is unlikely to go away on its own. She also says treatment is effective, even if it's years after a traumatic event.
There's often that question of when will I be ready for treatment? And I think if somebody is experiencing PTSD, they're a veteran and they served our country, they deserve treatment.
Family and friends can help those with post-traumatic stress by being supportive and willing to listen. Experts say a good first step for considering treatment is to reach out and speak with a therapist. Matt Hoffman, KPBS News.